everybody. We are going to tell you all about the aphasia diagnostic profile. And the people in our group are, I'm Emily.
Evelyn.
And we also have Kaylin and Zenzele in our group, who you'll see later.
We are talking about the ADP aphasia diagnostic profiles. The author is Nancy Helm Esterbrook, and it's published by ProEd in 1992. The age range for this test is adult, and it gives about 40 to 50 minutes for the test to be given, and it's given in English. The test assesses patients with aphasia. 9 subtests are 1. Personal info, 2. Writing, 3. Reading, 4. Fluency, 5. Naming, 6. Auditory comprehension, 7. Repetition, 8. Elicited gestures, and 9. Singing. The materials needed are the record form, black felt tip pen, various stimulus cards, and a tape recorder.
As a whole, this test gives you the patient's type of aphasia, severity of aphasia. It identifies their strengths and weaknesses. It also identifies their strongest communication modality, whether that's gestural or linguistic. It gives you an error profile showing where they're having difficulties, and lastly, a behavioral profile, and that shows their overall emotional state during the testing.
Hi, my name is Kaylin. I'm going to present the personal info section, subtest 1 on the aphasia diagnostic profiles. The personal info section consists of 8 questions about the patient's life. Verbal responses are recorded verbatim, while gestural responses and behaviors are simply noted on the form. The only material needed for this subject is the test booklet. In terms of scoring verbal responses, they're recorded on a 0 to 3 scale. 3 indicates immediately and fully correct, 2 indicates mostly correct, immediately, fully correct, with prolonged delay or self-correct. 1 indicates some correct, and a 0 indicates fully incorrect. A failure to respond at all earns a 0 score with a notated N for no response. Although the personal info section can be individually scored, it is supposed to be combined with the naming subtest score and the fluency subtest score for the grocery store picture you will see in a few minutes. These 3 individual scores are combined to give you the patient's lexical retrieval composite.
Hi, my name is Zenzele Shakir. I'm here to discuss the writing portion. The purpose for the writing portion is to assess the writing skills of the patient, that the patient is able to elicit the kinds of personal information that might be on official forms in everyday settings. The materials used are a black study felt tip pen, primarily for patients having difficulties managing a slim writing instrument that has a delicate point. Also to prevent patient from erasing any errors that they have. The second is a patient information sheet, and that sheet is to fill out the information for the writing section.
So this is subtest 3, and it's the reading comprehension section. We're going to be using that same form that Zenzele's writing section was using. So here what we're testing is reading comprehension skills, not necessarily reading out loud skills. The materials you'll need here are that same form and a pen for them to circle their answers. This testing is looking for their ability to process written language versus spoken language. And when you're showing them the form, be sure not to help them by reading the stimulus aloud, because we need to completely just test their comprehension by itself.
To turn on the tape recorder. Then say, I'd like you to tell me exactly what happened to you. Neutral probes such as, and then what happened? Or, can you tell me more? May be used. Card 1, the grocery store, and give the following instructions. I have a picture here. As you see, there's lots going on. Look it over and tell me about it. If the patient leaves out some important details, use neutral probes such as, any other details? Or what about here? Pointing to the butcher. Never use non-neutral probes, such as, what is the woman doing? For the picture description, count every word produced in response to initial prompt. Also count responses to neutral probes. Then you will tally up the number of words. Next, you will count the number of new pieces of correct information about the picture given by the patient. If the patient repeats, count only the best mention of a particular element. Then you will say to the patient, "That's fine. Now I want to test your memory a little. Do you remember President Kennedy? What can you tell me about him?" Again, neutral probes such as, "Can you tell me more?" may be used.
The naming subtest is the fifth subtest of the aphasia diagnostic profiles. This part consists of 12 pictured objects. The names of these objects vary in frequency, number of syllables, and phonemic complexity. Because all the objects can be described in gestures, the clinician is encouraged to note, but not score, gestural responses. All verbal responses are recorded verbatim and scored according to the 0 to 3 scale as previously addressed, with an N recorded for no response. This naming subtest score of the 3 subtest scores that are added together to make up the lexical retrieval composite score. The lexical retrieval composite score is used to help determine the overall aphasia severity and classification.
Section is on auditory comprehension. The purpose is to assess 3 areas of auditory comprehension: following commands, comprehension of single words, understanding stories. Scoring is 1 for correct, 0 incorrect, and no response. R is to indicate if the patient has asked or needs to ask the clinician to repeat the stimulus. The next is comprehension of single words. 10 object names are given on 5 cards that are depicted along with semantic, phonemic, and unrelated foibles. Scoring is the same as 1 correct, 0 incorrect, and for no response. However, the difference is that stimulus word can be repeated upon request. Understanding stories is the 3rd section. A story is read to the patient. Yes/no questions are asked to determine if patient understands what is being read to them. Head nods, gestures, and such are acceptable responses. To earn credit, the patient must respond correctly to both of the items in a pair. 1 for correct, 0 for incorrect, and N for no response. Okay, now for something new. Look at these pictures and show me the keys. Now, show me the clock.
What did you say?
Now show me the clock. It says here in the testing, 1 immediate repetition upon request is permitted without penalty, but should be noted in the R column.
I'm going to talk about subtest number 7, the repetition section. The purpose of this test is to find the severity and classification of the patient's aphasia. In this section, you're just going to be saying the words out loud and have the patient repeat after you. You want to record their answers verbatim and also record any of the additional errors that they may make. The materials for this section, all you're going to need is the record form.
We will be demonstrating the subtest of elicited gestures. Before beginning, tell the patient that you are going to ask him or her to pretend to do some things without talking. Then say, "Show me how to do such and such." Note that when testing oral movements, it's important to suppress any hand movements the patient might use as a form of self-cueing. Okay, now we're going to try some things without talking. Without talking, show me how to lick someone's ice cream cone. Without talking, show me how to blow out a candle.
The singing subtest is the 9th and final subtest. This section is composed of 3 items where the patient is shown a picture of an object associated with a well-known song. Patients are then asked to recall and produce the song associated with each picture. Each song can receive a maximum of 3 points. The first is for initiating the song, the second point is for carrying on the tune, The third point for producing some of the words. If the patient cannot initiate the song, then the clinician can initiate, but the patient must continue without assistance. The patient's ability to represent a concept through singing is credited in the alternative communication profile. Some patients can produce words only in singing, and these patients may be good candidates for a treatment called melodic intonation therapy. We're going to demonstrate the singing subtest of the aphasic diagnostic profile. Look at this picture. Can you think of a song to sing when presented with this?
Happy birthday to you.
Good job. Rock-a-bye baby.
Rock-a-bye baby on the treetop. My country 'tis of thee.
All right, so here's the behavioral profile, and you're going to complete this after the exam. And this is basically just noting down their status during testing. So there's these different columns and with different adjectives. So lethargic, somewhat lethargic, alert. And if you don't feel like they really match any of those, you would check no basis. And it goes all the way down from lethargic to confused to discouraged, and then the opposites of those: lucid, pleasant, self-confident, optimistic. And then again, if they don't match one of these in each column, go no basis. You add the totals down here, and then you'll put the total points here. And then if they weren't any of these, so there's 14 categories, you would subtract it from the no basis categories to see how many you actually tested. And then to get the behavioral profile raw score, you take the total points divided by the number of features you rated, and then times that score by 14. All right, here's the fun part. It's time to score the exams. There's 4 sections. There's the error profiles, there's classification profiles, scoring worksheet on the back, and the scoring summary. We're going to start with error profiles.
For the error profiles, follow these steps. Transfer the number of errors from each type from the totals row at the bottom of the record forms for each subtest. Record each total, if any, in the error count space at the top of the appropriate column to the corresponding profile. Find the rows SCS1, SCS2, and SCS3 in the profile that displays the range containing the total you have already entered. Record the number of that row in the standardized error score space at the bottom of the column. If the patient obtained a score higher than the highest score shown in row SCS3, enter 3. Next, we're going to look at the classification profile. To use the classification profile, you're going to find the lexical retrieval, ADP phase length, auditory comprehension, and repetition standard scores. Beginning with the lexical retrieval row, find the range that contains the patient's standard score. Follow the vertical rule leading down from that range to the appropriate box on the next row. In that box, again find the range containing the patient's standard score. Follow this procedure to the bottom row of boxes, or until no vertical rule leads down out of the box. The final box will contain the patient's aphasia classification.
All right, here's the third section for scoring. It's a scoring worksheet. So it has each of the subtests here. So go through and write down the raw scores from each section. It has the pages. And then once you have those raw scores, you're going to look in the manual over here to get the standard scores, which is the column on the right. And so here are your raw scores, standard scores, and then you're going to get percentile rankings. So you want to mark those back on your record sheet, the standard score here and the percentile ranking here.
What we're going to do is take our raw scores from each of these areas of personal information, reading, auditory comprehension, and such. We will use the table in Norms Table 1 to find the standard deviations and percentile rankings. Once we have found the sum in these areas, that information will be brought down to here, the standard scores in the summary area. And this is the scoring for the ADP.